very privileged to have these panelists with me this morning. And so I hope that my brief talk was able to provide you with a clearer view about the condition lupus that we are talking about this morning. And I think that at this point we can talk more in depth to talk about the certain issues and challenges that we face in taking care of a lupus patient locally. Maybe at the end of our discussion, we can also provide an open forum for you to be able to ask your questions. So I'd like to maybe start by asking this question to Dr. Chito Lucero, who is the president of PRA. So Dr. Chito is my friend, and as president, I'd like to maybe ask two questions. Maybe on a personal level as a clinician, we always talk about delay in diagnosis or challenges in getting the diagnosis of lupus early. What do you think are the reasons why, and what are the ways by which we can improve the early diagnosis and referral of this condition? Then maybe number two is, at the national level as the head of our society, what are the different programs and initiatives that we are currently doing to be able to address the many challenges in lupus patients?
Thank you for that question, Dr. John. By the way, this is my legal name, Auxencio Lorenz Lucero Jr., but I'm sure you will remember that. So just call me Dr. Chito. So just like Dr. Jombi, we have a shorter name. So for the first question, what makes it hard for other doctors to be able to recognize the condition? As eloquently discussed by Dr. Jombi a while ago, there's the presentation of lupus is very variable. So not all patients present the same way. So there are a lot of possible manifestations in a patient with a lupus, and sometimes in a primary care physician, they may not be able to correlate the individual manifestations in a patient with lupus, but can be correlated with a right doctor, for example, a rheumatologist. And hence, in his slide a while ago, he highlighted that usually there's a delay in the diagnosis of the patient of about 3 to 7 years, and therefore that translates also to a delay in the proper management of the patient. And as the head of PRA at the moment, we've been trying to address the issues at multiple levels. So for number one, through education. Let me just look at my notes because I really have to highlight this and take this opportunity to emphasize things that we are doing at the moment. So for education, we want to increase the level of awareness of our young doctors. So we start with medical students. We help them see that patients with autoimmune conditions like lupus should be diagnosed early. We help residents, particularly IM trainees and other relevant resident trainees in other specialties, to be able to diagnose them early. We attend medical conferences. We also attend medical conventions. So just this week we've had our PCP convention held in SMX BOA. Okay? So there we also had the opportunity to lecture about the autoimmune conditions. And then for lay fora, okay, we actually partner with media. You know? So sometimes some media invite PRA, and we send representatives to be able to discuss the issue, to raise awareness. One of the most commonly seen rheumatologists in media is Dr. Sandra Navarra, who has been our lead rheumatologist for several decades already. Unfortunately, she's not able to join us today. Okay? And then for programs that PRA is doing right now, we're actually doing two important projects at the moment. One is that we have partnered with a group called Physicians for Peace, and the role of Physicians for Peace is to develop benefit packages for different types of rheumatologic conditions especially lupus. And then once this is done, what we intend to do with this is to present it to PhilHealth, and I hope PhilHealth, with the proposal, will be able to come up with Z packages, similar to the way they do it with cancer or heart procedures. And then the other one is that we're also developing local CPGs. Okay, so this is led at the moment by Dr. Sandra Navarra. We're developing local CPGs that is adapted to the way we Filipinos, particularly doctors, manage the condition. Because at present, with the absence of local CPGs, we still refer to international CPGs that may or may not be applicable to Filipinos. Okay? And the purpose of developing the CPGs is that once finished, we're going to present it to DOH. If they accept it as a good CPG, then it becomes a formal document of the government, and PhilHealth can actually cover medications that are enumerated in those CPGs. So those are the two important things that we are doing at the moment.
Thank you very much, Chito. You could see talaga that the PRA is very, very busy doing all of these projects now. But I think one of the important aspects that Dr. Chito had emphasized is about education and awareness. And I think that is that's the most important step that we need to achieve, and that we are doing it at a very, very early level, at the level pa lang ng medical student, because they need to be aware of this particular condition. So I wanted to shift gears, and also we have, of course, our patients and our friends also here with us. And so we must remember that lupus patients have different stories to tell, different experiences. And so, well, I wanted to ask Ms. Melanie Cuevas, hello. So, Melanie, maybe you could share with us about maybe your most patient journey. In particular, maybe the challenges that we went through the diagnosis and management.
Okay. Well, first, as Doc Jombi said, I was actually diagnosed at around 17 years old. This was around 1995. But if you look back, I was really misdiagnosed. So, because previous to the official diagnosis, I actually had previous incidents that physicians diagnosed as rheumatoid arthritis, which is somehow in the spectrum also of autoimmune disorders. So I think that's one, that it's really a common, it really happens with, I work with Hope for Lupus right now, and that's really what a lot of them have to say, that they're really diagnosed later on when more severe symptoms manifest. So I think our role at Hope for Lupus is to really promote awareness. So even for the primary doctors, the pediatricians, or even those who don't specialize in rheumatology, to be able to kind of pinpoint maybe this is possibly an autoimmune issue, because it's really crucial to be diagnosed earlier. The earlier the better, because sometimes when a patient gets diagnosed, some damage has already been done, and that's irreversible. That's irreversible. So in my experience, so I was diagnosed at 17, and I was also put on, initially I was really put on a really high dose of steroids. And then eventually, as more medical advances have been were launched, doctors would diagnose me with newer medicines. But the disadvantage of that to other people is they're also very expensive. So not everyone will have access to all of these new treatments and experimental medicines that are out now in the market. What can be frustrating for a lupus patient is you have good and bad days. There are days like today I'm okay. and that's good now on wood. But there would be a time that for some reason I cannot explain, I just feel tired today for no reason. And then you'll have to kind of just listen to your body na, okay, maybe don't do so much for today. Maybe don't exercise for today. That sort of thing. And it's really a lifelong management. Like you have to see a lot, not just your main doctor, which is a rheumatologist, but you have to see so many doctors to be able to manage everything, because as Doc Joby said earlier, this is a multi-organ condition. So if, for example, the inflammation presents in the lungs, then you have to keep seeing a pulmonologist as well. Like this week, I'm supposed to be seeing a pulmonologist and an eye doctor, just to be able to check everything in the maintenance, because as Doc Jombi said previously, side effects can present later on in your eyes, so they have to monitor if you develop cataracts, those kind of things. So it's really a matter of patience and discipline that you have to keep seeing the doctors, constant monitoring to be able to be managed well. That's all.
Thank you, Melanie. And I think that was a very important point that you had mentioned. It's not just about underdiagnosis. Oftentimes it's also about misdiagnosis. And so the usual story that we hear from patients is that they go from one doctor to the other before the diagnosis is actually made. Maybe another follow-up question is, because Ms. Melanie is also the founding member of the Hope for Lupus Foundation and currently also a board member. And so we wanted to ask Ms. Melanie about any updates with regards to the lupus bill. This bill was actually filed in 2023 by Senator Villar, and maybe we'd just like to know about any updates on that and what you think would be the impact for our patients of this.
Actually, when you mentioned it, Doc, we had to research, okay, what was the bill about? So, in context, Doc, Senator Villar, his wife, one of our president, M, also has SLE. So I guess he dedicated this bill also for her. But going through the bill, it's still pending in the legislative committee. Going through the proposal, it aims to have PhilHealth cover the diagnostic tests necessary for autoimmune and specifically SLE, because actually even the test itself to diagnose SLE is expensive and not easily available in all hospitals, if I'm not mistaken, right? So that's one. And second is to have a comprehensive awareness program. It aims to have a National Lupus Awareness Week in the Philippines, and also to train healthcare workers to be able to identify, again, the symptoms, because as we always emphasize, it's important to really diagnose as early as possible. So hopefully, the bill gets passed soon.
Thank you. So we hope that we could lobby for this bill. And I think that, because I think I'll just mention normally our frustration is that when policymakers ask us about our disease, they always ask about the numbers. How many patients of lupus do you have? But we must realize that our condition is not as common as hypertension or diabetes. We understand that. But we must emphasize the patient's story, and that we must also let them understand that it's not about the numbers but the impact of the disease. Because majority of our patients are in their productive age group when they should be contributors to society, and the economic and social burden of this disease is what we need to emphasize. So I wanted to ask naman Ma'am Marilyn. Ma'am Marilyn is Also, we know each other already for many, many years. And she is also the president of the Lupus Foundation, Philippines. And maybe I wanted to ask, what else would you want to add in terms of your own patient journey? And second is maybe in your vast experience, I know that you have seen many stories with your patients. What are maybe improvements have you had in terms of perception of the disease by the public? Do you think that there has been any improvements? And what are still maybe the misconceptions that common folk have about this condition?
I'd like to acknowledge first the presence of my doctor, Dr. Noel Perez. He has a class and has rushed his class later, but I was really glad that he came. He is my lupus doctor. I have several doctors, but whenever I have a problem, my lupus doctor is always there. And that spells a lot of difference to a lupus patient. Very, very few lupus patients can claim that their lupus doctor will be there when they will have an operation, when they have to go through several emotional problems, mental problems, and financial problems. Of course, the financial problem is not covered because, please, we cannot expect the doctor to pay for us, you know. But then there are still many things that have gone and gone, have come and gone through the 30 years that I have been diagnosed. I was diagnosed on March 2, 1995. And I'm very, very proud to say I am of this age. As a matter of fact, I'm very proud because I look at you and I think I'm the oldest in this room. And I've gone through a cerebellum stroke, and that the first thing I told Dr. Chambi was, you know I'm rich because I have titanium on my hip. And of course, my friend says, Robelle says, hindi ka makakadaan sa sa airport. I said, no, I've tested. They can't read titanium. Anyway, I have been through a lot. I've seen lupus patients suffer. Many have talked about not being able to pay for basic things like prednisone. It's the cheapest. 250 lang yun. Hindi pa mabili. Pag hindi nabili ang prednisone, pag hindi pa nabili yung prednisone, ano pa ang kayang bilhin? Basic things that many patients, lupus patients would say, kaya yan bilhin. Because no matter yung galing ng doktor, basic na kaya mo namang bilhin kahit na konti lang. I'm very glad to hear that PhilHealth may come into the picture and pay for diagnostic exams. Yung anak pang health test yata, 18,000 na. It's a basic test. Para lang malaman kung talagang yung lupus mo nag-exist, saan yan papunta, you know. And then, meron ba yan maraming test? You just have to give your arm. Kukuna sila ng maraming dugo. That's it. So, if PhilHealth comes into the picture, fine. Now, anyway, I'm glad that nag-evolve na rin ang mga pasyente. Where before, they feel na Pag sinabi mo may lupus ka, mamamatay ka na, it's not exactly true. Well, it can be true to some extent. The reality is, lupus patients don't die immediately. They suffer. And they usually flash this beautiful fake smile. I'm not taking my smile now. Maybe if you ask me some very personal questions, I'll fake my smile. But most of the time, they suffer. Pain is not something that they can avoid. Yung doktor, what can the doctor do? It's the disease. So they will be prescribed. And then what happens? Momentarily they relieve. But is there really a drug that is going to keep this away? Or look for the cure for lupus? I should be wearing that picture. World Lupus Day, it says, I want a cure for lupus. Meron naman. But it's expensive. So the patient, especially in our group, hindi maaaring maka-afford. But they tried. But some can't. Has anybody ever stopped and asked the patients in PGH where majority of the patients come from? You know, if we have to do a discussion of lupus and the profile of lupus patients, it's going to take us quite a long time. Kasi pag-aaralan natin, ibababa natin. Talagang isa-isahin natin. And then, check, ano kung pwede namin gawin sa pasyente na to? The Lupus Foundation, for instance, works for primarily education of the patient. Kasi bago ako magturo sa iba, kailangan alam ko. Basic. How can you talk about your disease if you don't understand? And then you can create awareness by talking to the fellow next to you and explaining, ganito ang sakit ko. Hindi yung yesterday when I was young. Pagka nainis na akong tanong ng tanong about lupus, explain ako nag-explain. Alam mo, sasabihin ko, yung sakit ko, cancer. End of the discussion. See? So, that is how the lupus patient before, I relate my story 30 years ago, and how the lupus patient now looks at her condition. Very much better, very much positive. Because there is always somebody to tell her, you are not going to die. Hindi mo na pwede sabihin, hindi ka magsasuffer kasi ano yung storytelling alive. Yung talagang totoo, hindi ka mamamatay. Maghihirap ka ng konti, tiisin mo na lang. Basta punta na lang. Okay.
Thank you, Marilyn. Malaki talaga yung impact talaga when patients are